Fever is synonymous with pyrexia. Pyrexia is an elevation of body temperature caused by disease. It is only a clinical sign and occurs in a wide variety of pathologic conditions. Hyperpyrexia relates to a fever in excess of 105 degrees Fahrenheit. Types of fever. Intermittent fever is one in which the temperature falls to normal and rises again each day. A remittent fever is characterized by marked variation in temperature level each day. However, the low point is still above normal. A relapsing fever has short periods of increased temperature interspersed by periods of 1 or more days of normal temperature. A septic fever has large daily oscillations in body temperature. Mammals are endothermic vertebrates that are capable of generating sufficient heat to regulate their body temperature. Temperature regulation is a complicated reflex integrated by a thermoregulatory center in the hypothalamus. Thermal sensors are located throughout the body, but are most abundant in the skin, spinal cord, abdomen, and hypothalamus. Effectors of reflex are those structures actually involved in raising or lowering body temperature. Examples of this include skeletal muscles, skin, and respiratory system. Body heat is generated largely by the liver's oxidation of nutrients. During physical activity, much heat is generated by the muscles. The muscular system is very important to thermal regulation. Heat can be eliminated in the body in three ways: radiation, vaporization, and convection. In dogs and cats, the primary mechanism for heat loss is radiation and vaporization. Fanting is the primary means of dissipating excessive heat. The central thermoregulator is set at 101 to 102 degrees Fahrenheit, while peripheral vasoconstriction helps decrease heat loss and increase muscular activity through shivering, and peripheral vasodilation through panting and decreased muscular activity are used to dissipate heat. Generally, the mechanism for raising body temperature are sympathetic controlled, whereas depression of temperature is largely parasympathetic regulated. Pathophysiology of fever. Pyrogens are diseases or substances that induce fever and do not affect the effector side of the thermoregulatory reflex, whereas it affects the sensory and the integrating parts of the reflex. Fever occurs when the thermoregulatory set point is raised above normal. Activators of fever. Pyrogens is the fever-inducing substances. Exogenous pyrogen has some sources like bacterial endotoxin, gram-positive bacteria, viruses, and tumors, whereas endogenous pyrogen is the actual fever-inducing compound. It is released from neutrophils, monocytes, and eosinophils.
Lymphocytes do not release endogenous pyrogens. However, sensitized lymphocytes reacting with antigen release a soluble lymphokine that stimulates production of endogenous pyrogen in neutrophils and macrophages. Endogenous pyrogen is also released from fixed phagocytes such as Kupffer cells, splenic sinusoidal cells, alveolar macrophages, and peritoneal cells. There is considerable evidence that endogenous pyrogen either directly or indirectly elevates the thermoregulatory set point in the hypothalamus. The exact mechanism is unknown, but probably involves monoamines, prostaglandins, and cyclic AMP. Functions of fever. There is no conclusive proof that fever is either harmful or beneficial. Based on experiments in animals, fever may have the following beneficial effects. First, fever may directly inhibit the growth of microorganisms, both bacteria and viruses. Second, the suppressive effects of fever on the growth of microorganisms may be coupled with host defense mechanisms. For instance, serum iron levels decrease in animals with infection. Third, fever decreases the ability of bacteria to trap or chelate iron. Several immune responses may be affected by fever. Lysosomes are more easily broken down during fever. Proteolytic enzymes that are destructive to viral agents are released. Fever may also increase the production of interferon that infers with the growth of viruses. Leukocyte mobility and phagocytic activity are enhanced by fever. The bactericidal activities of leukocytes may be increased by fever. Lastly, fever may enhance lymphocyte transformation. Fever that accompanied by non-infectious conditions apparently has little useful purpose and may aggravate the other clinical signs. However, fever below 106 degrees Fahrenheit in dogs and cats are potentially beneficial, while fever above 106 degrees Fahrenheit are potentially harmful to cellular metabolism and should be suppressed. Diagnostic plan. Fever that results from acute inflammatory processes is usually easy to explain, and that cause is often found in the physical examination. Obscure or unexplained fevers are usually caused by chronic inflammatory processes that are difficult to define with routine physical or laboratory procedures. These fevers have been defined as fever of unknown origin. It has three characteristics. First, duration of at least 2 weeks. Second, temperature must exceed normal by 105 degrees on several occasions. And third, the etiology is obscure. There are 4 major disease categories when seeking the etiology of obscure fever. First, infections like bacteria, viral, fungal, and rickettsial. Second is immune-mediated. Third is neoplastic. And fourth is drug-induced. The database for dogs should include a CBC or a complete blood count, biochemical profile, urine analysis, aerobic and anaerobic blood cultures, antinuclear antibody test, thorough palpation of abdomen, and palpation of peripheral lymph nodes. The database for cats should include a complete blood count, biochemical profile, urine analysis, feline leukemia test, and feline infectious peritonitis titer. If these procedures are negative, blood cultures, antinuclear antibody test, and toxoplasmosis indicator determination should be included. Obscure causes of fever in dogs include bacterial endocarditis, systemic mycosis, ehrlichiosis, Rocky-mounted fever, toxoplasmosis, pyothorax, chronic hepatic disease, chronic pyelonephritis, chronic prostatitis or abscess, systemic lupus erythematosus, rheumatoid arthritis, polymyositis, lymphosarcoma, leukemia and other proliferative disorders, and tetracycline drug administration. While in cats, it includes feline leukemia virus-related disease, feline infectious peritonitis, toxoplasmosis, systemic lupus erythematosus, and polyarthritis. Symptomatic therapy. It is usually unnecessary to suppress fever unless the body temperature exceeds 105 degrees Fahrenheit. Fevers above this level may be harmful to body metabolism and may need to be suppressed. While hyperpyrexia, which is the body temperature above 106 degrees Fahrenheit, should be treated with cool water bath, ice packs, alcohol rub down, or cool water enemas. And cooling procedures should continue until the body temperature is down to 103 degrees Fahrenheit. glucocorticoids have potent antipyretic effects. These drugs reduce the amount of endogenous pyrogen released from leukocytes in response to endotoxin and sepsis. Thus, glucocorticoids may actually mask the fever of a serious disease. Fever monitoring is important in assessing response to therapy for septic conditions. Glucocorticoids as antipyretic agents may be useful in immune-mediated and neoplastic conditions. Glucocorticoids may also inhibit prostaglandin release and through this mechanism centrally inhibit fever production. Corticosteroids suppress leukocyte migration, local inflammatory responses, and immunologically mediated responses that may stimulate endogenous pyrogen release. Generally, it is very risky to use glucocorticoids to suppress fever since they actually potentiate and mask the progression of serious infections. Several drugs have antipyretic effects and do not lower body temperature unless fever is present. Aspirin and other salicylate-like antipyretics do not affect the production of endogenous pyrogen. Rather, the antipyretic effect may be related to the antiprostaglandin properties, and prostaglandin may play a role in the mechanism that allows endogenous pyrogen to induce fever. Aspirin and dipyrone are the drugs most commonly used in small animals, but the dosage must be carefully monitored since these drugs have side effects such as gastrointestinal irritation and ulceration, while for dipyrone it also causes bone marrow suppression. Certain phenothiazine compounds generally inhibit prostaglandin synthesis, interfere with central regulation of body temperature, and increase peripheral vasodilation. These effects may dramatically decrease fever. While dipyrone is the most commonly used in veterinary medicine, but it causes bone marrow suppression in cats if used repeatedly. Obviously, the decision to suppress fever must be weighed against its potential benefits. In the treatment of infection, fever suppression is seldom justified since this removes one method for monitoring the effectiveness of other drugs.